Chronic non-healing wounds are a massive global unmet need affecting millions of patients worldwide and causing an annual cost of more than $100 billion US. Patients suffer from pain, mobility loss, and reduced quality of life. In severe cases, chronic wounds such as diabetic foot ulcers can lead to amputation and even death. Aurealis Therapeutics has developed AUP-16, a novel 4-in-1 biological drug to treat chronic wounds. AUP-16 is a safe lactic acid bacterium that is genetically engineered to produce 3 therapeutic human proteins supporting all steps of the wound healing process. The 4th therapeutic component is the bacterium itself. Step 1. Conversion of chronic inflammation to acute inflammation. Upon AUP-16 application, the bacteria trigger an immune response, activating resident macrophages and recruiting more immune cells to the wound site. This wake-up step reboots the chronic inflammatory wound to an acute inflammatory wound. Step 2. Converting the hostile inflammatory environment to wound-healing inflammatory environment. The proteins produced by AUP-16, in particular IL-4 and CSF1, change the setup of the immune cells, cytokines, and growth factors, and convert the wound from a hostile pro-inflammatory state to an anti-inflammatory and regenerative state. Step 3. Proliferation. IL-4 and bFGF2 induce proliferation of fibroblasts, production of extracellular matrix, growth of new blood vessels, and initiate growth of skin epithelium. The 2 protein factors maintain the regenerative state for the time needed to complete wound healing. Step 4. Remodeling. Finally, the skin epithelium regrows to close the wound, and the skin layers are reinforced to form intact skin. AUP-16 has demonstrated a superior efficacy and safety profile in non-clinical studies. Clinical trials are ongoing in patients with non-healing diabetic foot ulcers to provide evidence of safety, tolerability, and efficacy of this novel solution to treat chronic wounds. Learn more at AureliusTherapeutics.com.